Significant amount of support, only one testimony in opposition. Chair is inclined to move the next bill with a defective date.
We are in support of this measure, and we did receive some funding last year, and progress is being made. But I have colleagues here from Hilo Medical Center. I think I'd like to have them share a little bit about why this measure is so needed. But I can tell you, as a physician, it would not only save lives, but improve the quality of life for folks who have heart attacks in the area. Because although they can be treated now, the treatment is not as effective as the interventional cardiac catheterization that we want to provide, which can really preserve heart function and muscle that would otherwise be lost during transport to Oahu.
We'd stand on our testimony. We got a whole bunch of testimony in support from our employees and those working on the units, working very hard to increase their skills and get ready for those patients to come in and take care of them.
I'm a practicing emergency physician for 35 years. The last 15 years I spent in Hilo Medical Center's emergency department. The most challenging cases I had to deal with were acute heart attacks. The reality is we put a lot of emphasis in the emergency room on getting things done fast. If you come in, you have chest pain, you don't give insurance information, you don't even get your temperature taken. You're taken immediately to a cardiac care room. And EKG is done, and when it shows that there's a heart attack, they call a STEMI alert. And that brings a whole bunch of people in with special training expertise so that we can expedite and get you care that you need quickly. Unfortunately, the standard of care now for treatment of people with acute heart attacks is for them to go to a catheterization lab, and this requires equipment personnel. That currently is not available anywhere on the Big Island. So for me as an emergency physician, what I mean, you come in, you're having a heart attack, and your life is at risk, and not only life, but lifestyle potentially after if you survive it. And what I've got to do, I recognize that this is what's going on. First thing I have to do is I try to start a drug to dissolve a clot that may be present. But while I'm doing that, I have to call Queens. Sometimes Queens would tell me there's no beds available. Then I have to call Castle and see if they have beds. Sometimes I would call Maui. Then I'd have to call the air ambulance. And the air ambulance said, well, the airplane is on Kauai right now. When it lands, we can send it to you. The standard of care requires this condition be treated within 90 minutes, and if done so, the outcomes are much, much better. I'm here to tell you, as a practical matter, living on the Big Island, the best I can do for you is 3 or 4 hours. That's too long. With your help last year, we have got the plane on the runway ready to go down. We've got the equipment, we've got personnel training, we have recruited ideally trained cardiologists. Mature people already have their experience. And one started in January. We'll have some others starting this summer. And so we are set up, and I believe on the projected path that we're on now, with the assistance of the legislature, we're going to have this service available by summer. We need to get the plane off the ground in the air, so we'll be back next year asking for help again. But overall, as a board, our commitment is to have this program available to the people of the Big Island. Once this specialty of care is available, we think it could be self-sufficient eventually, because they'll do more than just the emergencies. We'll have cardiac care at a much higher standard than we've experienced without travel before available on the Big Island. But the seed money that we're asking here in it is in addition to support you give us to have the facility open, but we think it's going to be a really good investment in for those of us that want to live on the Big Island that have family histories of heart trouble. This is an essential service, and we encourage your support of this measure.
In the 25 years I've worked in Hilo, I've served as chief of staff. This has always been the holy grail, the elusive holy grail. How do we provide good cardiac care? And we just haven't had the infrastructure. And again, it's hard to run into a family on the Big Island that hasn't had someone that's had a heart attack that hasn't been treated in a timely manner. 2 weeks ago, one of my relatives had a heart attack. A year ago, my close friend had a heart attack. They were transferred with medevac and had wonderful care in Honolulu, but with the 4, 5, 6 hour delay, they suffered heart muscle damage. That's not something that physicians can fix. And I spoke with Dr. Juno yesterday, who's the lead interventional cardiologist, extremely competent. And he points out that once you damage your heart muscle and you get congestive heart failure, it's actually worse than having the diagnosis of cancer. Your 5-year survival rate is only about 50%. Your 10-year survival rate is only about 15%. So it's just a scary thing to have. And with good diagnostic equipment in place, so Lori has placed a $4 million angio suite that, according to some of my colleagues, is better than what they have at Stanford University. Dr. Rosen provided a 640-slice CT scanner, provides excellent CT angiography. So we now have the tools, we have the nursing. This physician part is the last piece of the puzzle. It will definitely save lives.
It's primarily for the physical equipment or the doctors or the drugs and then she said that would be he said that would be the last piece, but you said this is kind of phase 1?
This is phase 2 of it.
Phase 2.
And the resources that we need to help to bring in is salary support in order. This is a very competitive field, and trying to get interventional cardiologists interested in living on a rural island. We're challenged to find people that want to live in Hawaii, but also we have to be realistic. We have to pay them on a scale that approximates what they make on So to support the cardiologists till the practices are built.
How many doctors would you need?
3 minimum.
So because of the new budget approach we're taking, where we are asking subject matter chairs to drive down into the operational budget, and I believe in this committee, Chair Mizuno has pulled out HHSC's budget. If we are going to add on, because this is a bill that's an add-on of $3 million, where do you suggest we cut? Because that's the exercise we have to engage in. If we add on, we have to cut. Who do you suggest we cut and where from? And it's a tough question. That's the question we're dealing with. So I would recommend that regional board needs to take a hard look at where we cut and where the cost savings are going to be.
Representative, if I could just address part of that. It's costing between $50,000 and $70,000 to fly someone over to medevac. Once a week, someone comes over here with a heart attack to Queens. If we just could cut down 2 of those 4 transfers every month, that would save over $1 million a year. If we could basically keep those 4 patients on the Big Island, if you can do the math on that, we'd be saving over $2 million a year just in transfer costs alone.
Okay, and then we have to look at the cost of salary and ongoing for the, so we have to find those cuts. And so that's what you guys have to begin to identify if this moves forward.
You understand that we are mindful of the need. Okay, I mean, we have 2 Hawaii Big Island legislators who died in the past few years because of the lack of cardiac support in East Hawaii. And I am supportive of our Kauai legislators, but the Big Island is over twice as far, over twice as long to get to Oahu. And if you live in Puna, it's another hour to get to even Hilo before we could even get to the airport to get to Oahu.
Exactly.
So we are mindful, and we do need to find out where the monies are coming from. And thank you very much for your concerns and the cost, but we are crunching it down. Thank you very much.